So we've opened our patient in PowerChart, and we are going to click the Add button. So regimens are a package of power plans. They are a group of power plans related to chemotherapy drug regimens, and all the orders within a regimen must have a diagnosis attached to them for billing. So we're going to show you the easiest way to do that in this ordering process. You can use the search portion right here and type in ONCR, which is how all of our regimens are titled unless they're a BMT preparative regimen. Then they're titled BMTR. But as you notice, there are a lot of regimens that you can choose from, and they're titled alphabetical based on the order that the drug is given first during their treatment. So it may not be the exact way you would expect to find the drug. So the easiest way is to actually search by disease state, which I will show you here. So if you notice on the left-hand side, we have a diagnoses and problems box. As long as you have a diagnosis already listed on this patient, such as breast cancer here, you can just click in the box next to that diagnosis, and that will attach the diagnosis to all of your orders. It saves you a ton of time downstream and saves you from getting a load of alert coming at you, reminding you to put that diagnosis in. If your patient had a problem listed down here, you could actually convert that to a diagnosis on this screen. So I'm going to add a problem in of anemia just to show you what the diagnosis button looks like. So the reason you would maybe do this is if it's the first time the patient's seen for the month, so they have all their chronic problems listed, or if the nurse had put in their problem list, but you have not had a chance to change that from a problem to a diagnosis. So notice that the anemia has a little DX button, and if I were to click that, it's going to turn that into a diagnosis, pop it up to the top, and actually put a little check mark next to it for me. So I'm going to uncheck it because I just want the breast cancer diagnosis attached to my orders. I've paid myself first. I've given myself the diagnosis. And then I'm going to go to my oncology transplant folder. This is the easiest way to find the correct regimen and make sure that you're ordering the correct dosage and cycles, etc., for the disease state. I'm now going to open up my breast cancer folder because that's what this patient has, so we'll keep fairly consistent. And just to do an easy cycle, we're going to do this ONCR, Tazalib, days 115, Q28 days is what I imagine, Q28 days. So click it once. And then I get the regimen attributes window. So although this top portion here isn't required, it's great to fill out so that way we can report out for cancer registry and cancer committee. The importance of doing this is as well for clinical trials, so we can pull data on how many people are on a particular study. We can find out, so yes or no, if they're on a clinical trial. What is the intent of therapy? And the line of therapy, first, second, third, fourth, or fifth. We have pre-auth and recommended protocol pre-selected for you, and then you want to select your start treatment date. Notice that it's just an estimated start date, and if you're wanting to start it really as soon as possible, but we're just starting this regimen, you have to schedule at least 1 week out. That's even if a patient has been on treatment, but we're changing treatment, we still need to get prior auth. They may need port placement. We just need to get some things in order before their first treatment day. So we want to select the radio button next to the week, and we'll say in 1 week. Notice that the date auto-populates for you, and again, that's an estimated start date. It's not your job to ask the patient what exact day they want to come in. The scheduler will work with them to get their treatment scheduled, their infusion scheduled. So we'll click OK, and then we'll hit Done. All right, we now have a regimen pulled up for you. One thing I noticed on this regimen is that it's missing the reference text, so I'm going to pull up another regimen for you just to show you what the reference text would look like. And again, this is our test environment, so we're still building some things, working out kinks. Not everything's complete, so we'll see some little nuances as we go through here. All right, so on this regimen, you'll notice that there's a piece of paper next to the title, and that is reference text related to that regimen. If I click on it, it's listed by disease state first. So if the drug's used in multiple disease states, we'll see different diseases. This particular one's only used in breast. And each plan has reference for the main phase 3 clinical trial. So not all clinical trials are going to be listed, just the main phase 3. So it's good if you need some information there. You can print this if you need to. And today we're just going to hit OK. So I'm not actually going to do this AC plan. So over here from my view, I'm just going to right click and remove it. And I'll go back to my plan that I do want to start. Okay. When you open your regimen, you have several options for what you want to do with your regimen. You have your start, which is starting your first cycle. The skip, if for some reason you did not want to start that cycle, it's not just skip a day. This is actually skipping the whole cycle 1. And move to the next one, where you can use that skip option. So if you had a patient that received treatment outside of this hospital or had loading doses elsewhere, you may want to skip the first cycle or two to get them back where they need to be. You also have an extend option. So we didn't build every single cycle into the system, just the most commonly used treatments. So you have the first 6 cycles, but let's say you already know in advance that you want this patient to have 8 cycles. You can click this extend button, say how many cycles that you want to extend out to. So if you want 2 additional occurrences of this cycle 6, you would select OK, and then notice it added a cycle 7 and 8 for us. You can also see that your dates are marked out. So we're going to go ahead and click Start on cycle 1. Starting the cycle, you get a box up at the top to confirm which cycle that you're starting. If this cycle had been started already on this patient in this system within the last 180 days, you would actually see a warning down here to alert you. If you didn't already select the start date and time, you get a chance to do it again. Save yourself here, but we actually already did that up front like good providers. And so we have our 10/9 estimated start date in a week. And then these are the 3 phases that you're going to see within your plan. You have your chemotherapy phase, your lab phase, and your scheduling. This additional review settings will not be in use until we put the chemotherapy actually into the plan. So we really just want to, if we've done all of our work up front, all this is a confirmation screen right here that this is what we're getting ready to order. We'll hit OK. So once you open, you can see over on the left, the easiest thing for me to remember is that the plan I'm working on or the cycle I'm working on is the one that has the 3 little light bulbs because we're getting ready to initiate those, sign those. So if I get lost in the chart somewhere, I can navigate myself back to those light bulbs. Your plan should open to your chemotherapy phase. And this phase will eventually hold our medications, but for now, what we have is our pharmacy consult and our infusion visit. So each day is, or each pharmacy consult will be present for different drug combinations. So this cycle only has one drug combination, only one drug listed, so it's only got one consult of pharmacy. But if you had several different drug therapies within a cycle, you would actually see several different pharmacy consults. You then have your infusion visits pre-calculated out for you. The only time your infusion visit would not be pre-calculated is if you had a titratable infusion. So we do here have to, for this example, have to select which infusion visit we want. Or cycle 1, day 1. So we want to select that visit there. So you've got your orders listed on the left, and then you have each day of your cycle. And then if you go down the columns, it's almost like a little checklist of what's planned, what's on the schedule for that day. So day 1 is going to have this 135-minute infusion visit. Day 15 is going to have the 105-minute infusion visit, but both days are going to have this consult of pharmacy. When we go through to day cycle 2, we'll talk a little more in detail about these things. You click on the lab phase here. This is the second phase that we'll have to address. And it has pre-selected and preloaded all the labs that you would want to order. There are also lab notes in here if there's indications of maybe different labs you want to order based on different cycles. The scheduling phase is the third phase, and again, but you should not have to touch that phase. That is just a summary of all of the scheduling visits you're getting ready to order. So really, as providers, you look at chemotherapy and lab. Anywhere you see the blue circle with the white X means you have missing details in that order, and you can address those as you go through the phases, or you can address them all at the end. For today's demonstration, we're just going to address them all at the end. So we've checked our chemo and our lab, we're good to go, so we're going to click Orders for Signature. Starting cycles. You only want to start number of cycles to your next visit. So if you see a patient during cycle 3, you would want to start cycles 1, 2, and 3. If you see a patient during cycle 2, you would only want to start cycles 1 and 2. The reason you don't want to start every single cycle in your regimen all up front is because if you have to delay treatment for whatever reason, then you have to touch each of those cycles. However, if you've only started cycle 1, 2, and 3, and then you decide on cycle 3 you have to delay treatment, the system will figure out the treatment days automatically for the remaining cycles. So if it's not been started, if it's not been activated, the system will help do work for you. But if you go through and try to say, oh, I'm going to save myself time up front and start all of this now, well, you may end up doing a lot more work in the future. Okay. So the system has recognized that I am missing order details. So I'll click my little first details button, and it takes me to my Onc Schedule lab visit. And if I scroll down, or I can click the yellow arrow, and it takes me to name if my patient has central line access, yes or no. And I'm going to say yes, because that's why we're waiting a week. We're waiting for them to get a port click. This will help where the lab order actually gets go to the lab phlebotomy queue. Well, in this order, I just want to show you that that diagnosis that we selected up front did attach to this order. If I click the diagnosis tab, you'll see that I have the check mark next to breast cancer. All right, that should be our only missing required detail because we have now 0 missing required details. So I will proceed to sign. So we just talked about how to search for your regimen using the oncology folders and the disease state folders. We talked about adding a diagnosis before you order anything, so that way you can get paid and you decrease the number of alerts that the system fires at you. We talked about placing the order for your regimen and starting cycle 1. Once I refresh, I'll be able to see on the left-hand side that my cycle has been ordered for future. So we have our scheduling phase initiated because those scheduling orders were sent to the scheduler's queue to be put on the calendar. And then we have our future labs and our future chemo. All right. So we do not see this patient until cycle 3, so we are going to go ahead and start our cycle 2. To get back to this page here where we can see all of our cycles, we select the regimen title from our view. Again, we still have our start, our skip, and our extend options. And then we also have added, now that we've started a cycle, we also have a repeat option. Repeat is if you actually want to repeat all of a particular cycle. If you determined during your cycle 1 ordering that you forgot to put a diagnosis in and you got tired of seeing those alerts, or you walked away and came back and can't remember if you put the diagnosis in, you can actually select right up here on this diagnosis button, and you can see what diagnoses are associated to this chart or to this regimen, and you can change that as well. You can also document a response from here. So if you want to, we only have started cycle 1, so that's the only option that's going to give us here. But if you wanted to document a response to their treatment, you could fill out that information. And it will have a response right there on the regimen, which is nice for when you go in to order your next cycle. So we'll go ahead and hit start on our cycle 2. So now that you've ordered cycle 2, you can see what was last ordered and who ordered it and what day. Confirm that the last thing you ordered was this previous cycle. You see your estimated start date down here, and we're going to click OK. Again, we have our chemo phase with the consult to pharmacy and your infusion visits. Now this time it is day 1 on not cycle 1, so we want to select that 105 infusion, and then you have your day 15 infusion. Let's say though here in our labs, this time we want to get an additional lab. We want to get and this is a bad example, so I'm going to go down to the Pembro that we had ordered previously. And what I want to show you here is actually, so some cycles, if they are supposed to be different every cycle as far as what labs you order, what the infusion visits are, it's not going to allow you to copy forward. But Pembro is the same from cycle to cycle. So it's going to let you copy forward details from cycle 1 into cycle 2. So if I click start on that Pembro, It is actually going, and I show you the lab phase, it actually already knows that this patient is going to be a central line. So let's add to phase our cortisol level here. We want it drawn on day 1. And another thing we can do is, like I showed you, we can subtract. Maybe we don't want to do the TSH. So I'm going to do orders for signature. Here's where I forgot to associate a diagnosis to this patient. So I'm going to click the breast cancer diagnosis and apply diagnosis to all phases. If I had selected diagnosis up front when I ordered the regimen, I would not have to address that. Here what I'm trying to simply sign through my orders. Okay, so we've signed those orders. So I'm going to go back up to my Pembro regimen, which has been started. So now I have cycle 1, cycle 2 in progress. I've still got my repeat, skip, and extend options. And I've got my start and my copy forward from cycle 2. So like I said, I noticed, oops, I forgot to add my diagnosis before I started this, before I ordered this regimen. So I'm going to click on diagnoses. And I want all diagnoses. And let's add cancer. Start admitting diagnosis. And okay. And now we're going to hit start. Again, it tells us the last item that was ordered on this patient, estimated start date, and what we're getting ready to order. Okay. And if I find in my view here my light bulbs, I can easily click my lab phase. Okay, so our lab phase, we had added that cortisol level and unselected our TSH. So it copied forward that information for us into this phase. I know that the cortisol has been a lab that was added because it's got this little plus sign with the note. And it tells me that the order was included because it had been added to the phase. So let's say we want to go back to our basics here. We don't want a cortisol level. We just simply unselect it, but we do want our TSH and T4. You can either select it here on the left-hand side, or you could use a minus over here on the right hand. You can either select or unselect on the left-hand side, or you can use the plus in the actions column, plus minus. All right. Another thing you can do with adding to phase on on these regimens is to go ahead and add in your follow-up. And we recommend you do that on the chemotherapy phase. So if I wanted to add to phase in order, and I type in my ONC SCH follow-up, and I do a follow-up 15 minutes. This would be if you want to follow up with them on the same day of treatment. So let's say you always want to see your patients on the first day of their treatment cycle. You can add a follow-up for a day of treatment. You have to select the provider that you're following up with. So we're going to have them follow up with Dr. Riley. And you have to select their clinic. So, all right. So we've added a follow-up visit for cycle 1, or for day 1 of your cycle. We've adjusted our labs, and we're going to go ahead and hit orders for signature. We needed to add some order details to those labs, so we're just going to make them routine. If they're scheduled, they'll be routine. And then we'll assign our orders. Processing, please refresh. Yeah, I am running out of battery on my laptop, but I think we'll get through the rest of this. Okay, so we've started a couple of cycles here. I go back to my Pembro. Notice I've got my cycle 1, 2, 3 started. So you've talked to your patient, and for whatever reason, we need to delay your patient for cycle 3. So in order to delay the treatment, we are going to click Add. We're going to go ahead and save ourselves some time and add our diagnosis before we type in our ONC delay and select our delay of treatment order. This delay of treatment is going to be the reason that you're delaying treatment and replaces the current consult to pharmacy you have. Right now that consult to pharmacy is pretty generic and it gets lost in the weeds. This will route directly to the correct pharmacist queue in order to get those medications delayed properly. So let's say this is a hematologic issue that we're having to delay. You could put additional instructions in here. Maybe they're WBCs are incorrect, but you just need to do a reason here, and you could actually have multiple if you wanted by clicking the control key. Maybe it was hematologic and the patient requested that they delay. So you would sign that order, and that's your communication to pharmacy, but that's not the order to actually delay the treatment as far as what do you want to do about their labs? When do you actually want them to come in? In order to communicate when your patient should come in for their actual next treatment, or maybe when they're if they need to get additional labs drawn, you actually have to do that process within the regimen. So we've delayed our treatment. Great. Or we've sent our communication to the pharmacy, and we are going to delay our cycle 3. So you can find your cycle 3 one of 2 ways. You can find your regimen name here and then go directly into that cycle, or if you can navigate through this view easy, you can click directly on your cycle. I recommend that you find the regimen name and then click on the cycle. So you found your cycle, you review, okay, yep, that's what I'm wanting to delay. We'll click on our chemotherapy phase, and that's where we get our nice little grid. So what we want to do is change our start date and time. So in this actions column, we use the down arrow next to our activate actions, and we're going to change our start date and time. And it was supposed to be on 11/8, but we're going to have to delay it out maybe 2 days. Well, it was on a Friday, so we're going to delay it out to Tuesday, 11/12. And we're going to request a new appointment time. And our reschedule reason, we'll say abnormal neutropenia. And then notice we have the option, we are saying that we do want to adjust all subsequent regimen elements. So that is all the remaining cycles that we haven't started yet, we want to adjust as well. So we'll click OK. We now get a reschedule option for our infusion. Let's then say, let's pretend here that I'm going to hit activate on these. This is what your nurse would do. Pretend that we want to redraw all these labs. So in our actions column, we're going to do copy day of treatment. And it's going to ask you what day do you want to do it. Let's say we want to, they're coming in Tuesday, we want these labs redrawn on Monday. Hit OK. What's nice about this is that it went ahead and added your extra scheduling visit on here, and it copied all of your labs. If you wanted everything redrawn except for their CMP was fine. They've not had any issues with that. We'll save them some blood. We'll go ahead and subtract that CMP order. If you wanted to add it back, you get your plus sign and you could add it back. All right, so we've now delayed out our labs and we've delayed out our chemotherapy. So we're going to do orders for signature and sign. All right, so that is quick regimens in a nutshell. We talked about how to find the regimens by going to your Add button, going to your Oncology transplant folder, and searching for your regimen by disease stage. We talked about before you ever even want to add any orders to your scratch pad, you want to select a diagnosis. We have talked about once you do add the regimen, you have your regimen attributes that, although not required, are extremely helpful for when we want to pull reporting data. And then we talked about starting cycles and delaying treatment. So I'm going to refresh my screen here and show you, hopefully, if our system is working correctly today. When I go to this Pembro regimen, it'll show my delayed treatment. I delayed that out to the 12th. So now my cycle 4 estimated start date is the 3rd. Which, if I look at a calendar, should be 21 days out. So my cycle 3 was supposed to start on the 8th, which means that cycle 4 would be the 29th, but I now don't want it to start to the 12th, which we can see is the 3rd. So just a little calendar proof that marched out. If I had already started all of these cycles, it would not adjust accordingly. I would have to manually go in and adjust those. So I just want to hit start on this cycle 4 to show you how it works if you've had to delay. So you're not going to, this alert is where we copied that day 1 because we wanted to redraw all those labs. The cycle 4 is not going to copy those elements forward. It's just going to bring forward the additional, the original cycle option. So you can see what my last order was, my estimated start date, and my elements of your regimen. If you notice, we now have this follow-up visit added in here with my details to follow up with Dr. Riley in the breast clinic, and we want that to occur on my day 1 of this cycle. If I go down to my lab, I have that cortisol level that I had previously added in, and then I have all my lab details. So the copy forward is really nice if you're doing fairly consistent things from one phase to the next or from one cycle to the next, as well as if you're maybe every other cycle you want to have this cortisol level drawn. You could add it to phase 1 time, and then once you're in here doing your ordering, all you have to do is choose whether or not you want to order it on that day. So we'll say that we're just not going to make any adjustments. It's great how it was before. I'm going to just keep everything the same. So we're going to click our orders for signature, and I should not have any missing details to sign. All right. So those are our regimens.